HLA Crossmatching, T-cell crossmatch test. 1. Introduction. Today, I'm going to speak about a very important laboratory test in the field of organ transplantation, the HLA Crossmatch test, specifically the T-cell crossmatch. Organ transplantation is a life-saving procedure for patients with end-stage organ failure. However, the biggest challenge is the possibility of the recipient's immune system rejecting the donor organ. Cross-matching is one of the key tests that helps doctors predict and prevent such rejection before the surgery takes place. 2. Definition. HLA stands for human leukocyte antigen, which are proteins present on the surface of almost all cells in the human body. They play a critical role in the immune system by distinguishing self from non-self. The T-cell crossmatch is a laboratory test that determines whether the recipient has preformed antibodies against the donor's T lymphocytes. If these antibodies are present, they can destroy the donor organ after transplantation. 3. Indications. This test is indicated in the following situations: before all solid organ transplants like kidney, heart, lung, or liver; in recipients who have had multiple blood transfusions, as transfusions can introduce foreign HLA antigens; in patients with previous transplant failures, which may have triggered antibody formation; in women who have been pregnant, as exposure to paternal antigens can stimulate HLA antibody production. For the test is used to determine compatibility between a donor and recipient, prevent hyperacute rejection, which occurs minutes to hours after transplant, help doctors select the most suitable donor when multiple donors are available, guide treatment decisions if antibodies are detected. 5. Why do this test? Need of the test. The test is needed because organ rejection can be catastrophic. If a transplant proceeds despite a positive T-cell crossmatch, the recipient's immune system will immediately attack the donor organ, leading to rapid graft failure. This test therefore acts like a safety check, ensuring the organ will have the best chance to function in the recipient's body. 6. What happens during the test? Blood samples are collected from both donor and recipient. The recipient's serum, which may contain antibodies, is mixed with the donor's T lymphocytes. If antibodies are present, they will bind to the donor T cells. When a complement system reagent is added, these cells are destroyed. The reaction is then observed under a microscope in the traditional CDC, complement-dependent cytotoxicity method, or measured using more sensitive methods like flow cytometry. The presence of cell death indicates a positive crossmatch. 7. How long for results? Traditional CDC crossmatch results are available in a few hours. Flow cytometry crossmatch is also relatively quick and may be reported within the same day. This speed is crucial, especially when a donor organ becomes available unexpectedly and time is limited. 8. Preparation for the test. Usually, no fasting or special preparation is needed. However, patients should inform doctors about any recent blood transfusions, pregnancy history, medications, or immunotherapy. These factors may influence antibody levels and therefore test results. 9. Risks. The test itself is safe because it requires only blood sampling. Risks are minimal and limited to slight pain during needle insertion, small bruise or swelling at the puncture site, rare risk of dizziness or fainting during blood draw. 10. Normal values. A negative T-cell crossmatch is considered normal. This means there are no harmful antibodies in the recipient's blood against the donor's T cells, and transplantation can usually proceed safely. Chef 11. Interpretation of results. Negative crossmatch, compatible, low risk of rejection, transplantation is safe. Positive crossmatch, incompatible, presence of antibodies, high risk of hyperacute or acute rejection. In such cases, doctors may advise against using that donor or consider desensitization therapy. NASHTR 12. Factors affecting results. Several factors can affect crossmatch results, including recent blood transfusions that may introduce foreign antigens, previous transplantations, which may sensitize the immune system, pregnancies, as the mother's body may develop antibodies to paternal antigens, certain infections or autoimmune conditions that stimulate antibody production. Part 13. Clinical significance. The T-cell crossmatch test is one of the most critical steps in transplant evaluation. Its significance includes preventing hyperacute rejection, which is immediate and irreversible, improving graft survival rates, reducing overall complications after transplant surgery. Without this test, many transplants would fail within hours, wasting both the donor organ and risking the recipient's life. 14. Know more. Apart from T-cell crossmatch, doctors may also perform a B-cell crossmatch to detect antibodies against B lymphocytes. Modern technology like Luminex assay and flow cytometry crossmatch have improved accuracy and sensitivity. In some high-risk cases, if the crossmatch is positive, treatments such as plasmapheresis, intravenous immunoglobulin, or rituximab therapy can sometimes reduce antibody levels and make transplantation possible. 15. Conclusion. In conclusion, the HLA T-cell crossmatch test is a life-saving investigation before organ transplantation. It acts as a guardian, ensuring that the recipient's immune system will accept the donor organ rather than reject it. A negative crossmatch result is a green light for transplantation, while a positive result serves as a warning to prevent a potentially fatal rejection. This simple yet powerful test not only improves patient outcomes, but also ensures that precious donor organs are utilized successfully, giving patients a second chance at life. Thank you. Have a nice day.